We also want to just welcome to our heavenly facilitators. Um, God the Father, who is the master designer of marriage. God the Son, who is the minister of reconciliation. And God the Holy Spirit, who is the resident counselor. And how we need all three of them tonight. And we need them in everything that we do in all of our lives. So we are grateful that they're here with us tonight, and we want to welcome them, and we want to ensure that we are open and waiting to see what they will bring about in our meeting tonight. So as I mentioned, GAM, the vision of God's Anatomy for Marriage is to bring renewal and wholeness to marital unions, using God's redemptive and restorative ideal solutions as found in the Word of God. So what we do is based on the Word of God. We want to follow God's, way, what He has laid down for us in how we engage our marriages. The mission is intensive intervention for God's first institution, which is marriage. So that's a little about God's Anatomy for Marriage. So welcome again. I am going to turn over to Jennifer, who has something that she wants us to engage in at this time.
Pleasant good evening to my sisters on the platform. It's always, always so nice to see you all. And just for us to share, with each other. Nurse Practitioner, Angella Dacres. And she is a Jamaican by birth, but she has been residing in Canada for as long as she can remember. Umpteenth years she has been there, so she's practicing. She wears many hats, and she is a very strong, committed Christian woman, and she is the one who will be leading our thoughts.
Pleasant good evening, everyone. Hope you're all doing well this evening. To God be the glory. Just want to thank Him for the opportunity to be able to present this presentation. For those that do not know who I am, my name is Angella Dacres. I am a nurse practitioner. I work in neurology, although I have vast knowledge in any area. And so today the presentation will be on menopause and andropause. We will highlight the definitions, the signs and symptoms, and also, we'll talk about male menopause, or the other term is andropause. Some individuals do not feel that men go through menopause, but they in fact do. Different symptoms, some are same as female. However, we will touch on each topic area. So just to cover some of the definitions, amenorrhea, when you hear that term, it is basically the cessation of menstruation. So whether menstruation has ceased, whether for a month or two, that is the term, medical term for not having any period. And then we'll talk about estrogen and progesterone. Those are the female hormones. And then we'll also touch on testosterone, which is mainly male, although some female also have testosterone, but it's mostly a male hormone. And we'll also talk about the meaning of perimenopause. So these are all some of the definitions that will be highlighted throughout the presentation as we go through. So as mentioned, amenorrhea is the absence of menstruation, which is often defined as whether I'm missing one period or more than one menstrual periods. So for example, in the sense of a female that is pregnant and has had no menstruation, that is what you call amenorrhea. So they're not having period because of childbirth, but we'll also speak about amenorrhea in the form of menopause, because when individuals have reached menopause, going through menopause, then they will have no period. So if you hear the term amenorrhea, you know that it's absent of menstruation. So when we look at one of the female hormone, which is estrogen, um, it's a category. It's, as I mentioned before, there's estrogen, progesterone. Some individuals may have testosterone, um, and they have various features that you can tell that they have an increased testosterone. But as I mentioned, testosterone is mostly a male hormone. So estrogen is responsible for development and regulation of the female reproductive system and secondary sex characteristics. We know that estrogen plays a role in male and female reproductive system. Progesterone is another hormone that plays an important role in the reproductive system again. It supports menstruation and helps maintain the early stages of pregnancy. So progesterone prepares the endometrium, which is the lining of the uterus, for a fertilized egg to implant and grow. So, some individuals that may have difficulty with implanting an implantation of an egg to the point where they're able to carry that egg, go through the stages, pregnancy, um, progesterone may have something to do with that, right? So there are certain things that may be happening in the body where individuals are not aware of, and it contributes to because of different reasons. So progesterone is a very important hormone. So if a pregnancy doesn't occur, the endometrium shreds, right? So remember I said the endometrium is the lining of the uterus. So if pregnancy doesn't occur, then there's shredding, which occurs during the menstrual period. If conception occurs, progesterone will increases to support the pregnancy, right? So basically, an individual, there's intimacy, the egg implanted, fertilized, and grow towards having a child. If that does not occur, then there's shredding. So that's when individuals get their menstruation because of the shredding of the lining of the uterus. In terms of estrogen level, the reference range of estrol in men is 10 to 40, and for female, there are different levels depending on the phase. So there's different phase. So I won't get into that because I don't want anyone to be overburdened by that and the numbers. But just need to know that there are various phases, and depend on the phase will determine the the numbers. So now we come to menopause, and let's talk about what is menopause. So somebody was to say to you, I am going through menopause. Um, you know, what is menopause? What really does it mean? So menopause is permanent cessation. So end of menstruation. There's no more period. There's no more menstrual cycle. That's it. Finito. Done. So remember I mentioned earlier that amenorrhea, which is you can have a cessation of menstruation for 1 month to 2 months, whereas menopause is after 12 months of no menstruation, then you can say, yes, menopause is here. So menopause is something that no one can stop. It's something that will happen. It's a part of aging process. And some individuals may start menopause earlier than others, but the average age is 51 years old. So some individuals, even in their 30s, mid 30s, 35, can have some symptom of menopause, or what we call perimenopause, which I will talk about. Um, when in menopause, the estrogen level is low, um, rather. So, as we mentioned earlier, estrogen and progesterone are very important hormones, but when menopause comes, those levels will be low. And the way to find out the levels would be by blood work. So lower levels of hormone, estrogen and progesterone, and when woman is no longer able to become pregnant. So if somebody was to ask you what is menopause, then it's a natural process. It's a part of aging. There's cessation of menstrual cycle. At least 12 months would have passed without a menstrual period. So those are some of the things or terms that can be used when we talk about menopause. We'll go into the signs and symptoms as I proceed. So menopausal transition. So ovarian follicles depletes. There is change in bleeding pattern. So there may be fluctuation. So 1 month, you may have a period, they may skip, and then you have another period. Just remember that individuals have the length of their periods varies. So some may be for 3 up to 7 days, but it varies. There's early transition. Some people may transition in their 40s, and there's late transition where you skip a cycle. So you may have a period today, this month, there may not be one for next month, there's not one the following month. So that's late transition. Perimenopausal. Perimenopausal means around. The word peri means around. So it refers to the time during which the body makes the natural transition to menopause, marking the end of the reproductive years, right? So during that time, it is difficult for one to um, you know, become pregnant, have children. But again, all things said, this is based on science. We know that, God is God and He can do things beyond our imagination. And so you may see some may ask, well, individuals that are in their late 40s or 50s has had children. It may just mean that they have a lot amount of estrogen, progesterone, and so that their levels were continuously high, right? Um, Women start perimenopause at different ages, as I said before. Some individuals in their 30s, some in their 40s, some in their 50s. Some may notice signs of progression toward menopause, such as menstrual irregularity, as I mentioned before. So, let's say for a person who would have had their period for about 5 days, they may notice, well, I'm only having it for 3 days. Or they may notice, I skip a month. I didn't see my period last month. And you're wondering, why is that the case? So these are some of the things leading up to. Um, some women notice change, as I mentioned, in their mid 30s. So every individual is different, and you cannot use someone else's story as your story because your story will be different from their story. Um, you can't say, well, Mary Jane um, told me about these symptoms when she was in her 40s, and I heard of someone else in their 50s. Some people go through menopause and don't experience any symptoms, or their symptoms are so mild that they do not attribute it to menopause. So, in terms of perimenopause, occurs after the reproductive years. It's the period before menopause. As I mentioned, there can be irregular menstrual cycle, and this is where individuals will get various symptoms. So some people may get hot flashes. And when you say hot flashes, what does that mean? Um, because you may be in your 50s and you've never experienced hot flashes. What about your daily routine, and suddenly you feel a hotness come over? Usually starts on the face to the neck, and then it can go down to the wards of the body, but that's usually where it starts. Some people break out in sweats. Um, there can also be symptoms such as sleep changes, mood changes, vaginal dryness, and bone loss. Um, as mentioned, this can occur during the age of 40 to 45 years old. On average, begins 4 years before final menstruation. So that is, um, what perimenopause may mean. So although somebody may be in their 40s and they're getting hot flashes and they're wondering, hmm, well, I'm too young for menopause. Not necessarily. Um, so these are also some of the things and reason why um, they often encourage those individuals who are looking to become parents to start early, because it's known that even in your 30s you can be experiencing some of these symptoms. Um, so just to recap that again, menopause, absence of menstrual cycle for 12 consecutive months, and subsequent absences of female sex hormones, including estrogen, progesterone, and as I mentioned earlier, some in the females do have testosterone, um, although it is a male hormone. And perimenopause, again, here you have fluctuation to frequency of menstrual cycle and subsequently fluctuation in female sex hormones. Menopausal hot flashes. So only 20 to 30% of women seek medical attention for hot flashes. So some people, it is so unbearable that they feel like they have to, get medical attention. As I mentioned, it's sudden sensation. It's like, individuals have described it as feeling like they're on fire. Upper chest, the face, and then all over the body. The thing to know is that this lasts for anywhere from seconds, 2 to 4 minutes. There can be profuse perspiration, possibly palpitation, fast heart beating, and you'll see why, palpitation or fast heart beating is mentioned, because the hormones are in different areas, of the body, or control, or has to do with different areas of the body. Um, there's no set timing when this can occur. It could be 1 time per day, 2 time per day, 3 time per day. There's no timing. This can occur several times per day. And some individuals say that they experience these symptoms at night, mostly at night. So some may have difficulty with sleeping because of, if you're having such a sensation, it will be difficult to sleep. So again, there are different areas that is affected. You'll see symptom in different areas. So for example, some individuals may have hair loss. That's a sign of menopause. Itchy skin, hot flashes, um, dryness of the skin, and night sweats. Irregular heartbeat. There may be breast pain. Individuals may have difficulty with digestion, and where you see loss of libido there, it just means their sex drive is decreased. There can be vaginal dryness, menstrual periods that occur less often, and as I mentioned, cease altogether. Individuals may have joint pain, or what we call osteoporosis. Some may have frequent urination and urinary pain, so it may burn when they pee. They may have some tingling sensation, and also the nails may be brittle. There are also other signs and symptoms. Can be fatigue, so no energy, loss of energy, feeling tired, dizziness, irritability. Some individuals have headache. There can be depression, weight gain, mood swings, and memory lapses. So a lot of signs and symptoms that can be attributed to menopause. And again, some of the things that have already been mentioned, because as I mentioned, the estrogen receptors are in different areas of the body. So in the brain, therefore, you have the hot flashes, difficulty with sleeping, which is insomnia, irritability, mood disturbances, and dementia. The breast, as I mentioned before, can be affected. The eye is affected. The genitourinary tract, so vaginal atrophy. That means that just shrinking. Stress incontinence is usually what that means is A lot of times individuals may be sneezing and they dribble, right? So, or laughing, some individuals laugh very hard and therefore they get dribbles. So that is what stress incontinence mean. Um, Heart and blood vessels, so cardiac vascular disease, liver, um, or ovaries, skeletal, skin and hair. So, um, a lot of areas are affected based on where the estrogen receptors are located. So, in terms of, diagnoses, induced menopause, immediate or sudden menopause when ovaries does not no longer produce hormones. So that is one of the way to diagnose is looking at the blood level to see what the levels are, and therefore that is a way to tell that menopause is here. Some individuals have had surgical removal of their ovaries, right? So some individuals have had total hysterectomy because of, various reasons. So they've lost their ovaries, or individuals that have gone through chemotherapy or radiation. Um, those are some of the ways to diagnose um, menopause. So now we'll talk about males. And the question often comes up, do male go through menopause? Is this a fact or is this a myth? What do you think? Can you look back and say, yes, I think based on some of the things that you will hear, my partner has gone through this, or my partner has had this symptom, or this has been going on with my partner, and therefore, maybe he was going through menopause. So the term male menopause has been used to describe decreasing testosterone levels related to aging. So in terms of the male menopause, others may know the term as andropause. Same term meaning male menopause. So women, on the other hand, ovulation ends and hormone production plummets within a short period of time. With male, reduction of testosterone and other hormones decline over a period of several years, known as age-related low testosterone. Men testosterone levels decline 1% yearly after age 40. So again, levels is checked by blood tests. Most men experience no symptoms with low testosterone. And, as I mentioned before, some women go through menopause and they don't know. So, same thing, some men may have low testosterone, but they do not experience any symptoms. So, some of the possible signs seen in males, there's a reduced desire to be engaged in sexual activity, not interested. Decreased spontaneous erections, or there is some dysfunction. Again, they can have breast discomfort or swelling, infertility, so just can't, just cannot have children, because of sperm count, so they're unable to be fathers to children. Height loss. So you've seen a male that was 5'11", and all of a sudden he look and you're like, look like 5'7", right? So there is height loss. There is also bone loss. So they may have fracture easily because of bone loss. And also they may have hot flashes or sweats. So almost some of the same symptom that women go through, males also will go through. Um, so again, they may have decreased energy, motivation and confidence decrease. They may feel depressed as well. They may have poor concentration, increased sleepiness, or they may not be able to sleep. And they may have, mild anemia or low blood count, reduced muscle bulk and strength, um, and increased body fat. So, also as with female, male do have a lot of symptoms, but really and truly, when you look at these symptoms, they're never, or they may have never been attributed to menopause. They may be because of different things, like decreased energy could be because they've been working, so they're tired. Um, increased sleepiness. They need to sleep, because of work. So a lot of things may not be tied to because of other reasons. So in terms of treatment, so treatment recommendation for older men with low testosterone. So some male, as mentioned before, they may not have any symptoms, although their testosterone is low, and therefore there is no recommendation for offering testosterone treatment for those individuals because they're not having any symptoms. Whereas some may say to offer testosterone to men with low testosterone even though they don't have symptoms. So it all varies. Um, the recommendation from the American College of Physicians is that doctors should consider starting testosterone treatment in men with sexual dysfunction who want to improve their sexuality, right? So this would have to be a discussion, talk about, the pros and the cons and decision made whether or not that's the way to go. Um, so we've already spoke about effects of estrogen. I've already covered the various areas. So this is just another diagram outlining the areas that have been affected. So in all of this, whether it is male or female, in the middle, we have low libido. And what does that mean? What is libido? It is, some would term it as sex drive. And there are various factors why that could be the case. So in the case of a female, there's vaginal discomfort, whether it's because of dryness, um, there's, itchy, as I mentioned, some of those symptoms before, those can all contribute to. They're just feeling depressed, feeling low, feeling tired, um, not feeling attractive, low self-esteem because of some of those symptoms, and not feeling emotionally interested. So all those things can lead to low sex drive. So vaginal dryness and genitourinary symptoms. So if you look at the picture on the extreme left, it shows the vagina before menopause. And if you see where the arrows are pointing, so it's basically the vagina lining, which is thick and moist before menopause. and blood flow is good. Now, if you move over to the second picture in the middle, you see the walls there's flexibility in the walls, but as menopause occurs, then there's decreased flexibility. So after menopause, the lining becomes thin and dry. Now, do you see the difference between the two pictures? And there is also less blood supply. So that would, explain why some of these symptoms occur. So the most common symptoms of vaginal dryness, itchy in the vaginal area, burning sensation, increase in frequency. So individuals want to go to the bathroom so often to urinate. That is what we term increased frequency. There's, discomfort, whether through wearing tight clothing. So again, the recommendation would be to wear loose clothing. There can be painful intercourse, light bleeding. So some individuals may still have light bleeding because, remember, because of that dryness, that can cause skin tear, and there can also be stinging and irritation. So to combat vaginal dryness, there are, of course, lubricants that can be used to assist with, the dryness and promote intimacy. So if we further look into the male menopause or male andropause, um, you know, as I mentioned before, it affects male just menopause affects male just as it does female. So, and it could be, at any age as well. Some of the common symptoms of a low sex drive in male could be difficulty with getting erections, or erection is not as strong as they used to be. Lack of energy, they could be depressed, irritable, and have mood swings. So again, this is just a picture showing the different signs and symptoms that may occur: muscle loss, low energy, lack of focus, bone loss. Some may have weight gain, difficulty with sleeping, night sweats, headache, depression. So now you can see that male go through these symptoms as much as the female does. So in terms of treatment, it's really making healthier lifestyle choices, healthy diet, regular exercise, reduction of stress, and increased sleep. Oftentimes on medical treatment, a medical treatment is maybe required, right? Last resort is usually hormone replacement therapy. So, it just depends on what is happening, the severity, and this has to be a discussion with the male to see if that's something they would consider. So, again, you can see, but I think the most important thing to note is that menopause can occur in men as it can in female. And as I mentioned before, um, a lot of times individuals may have these symptoms, but they do not tie them to menopause because they can happen for other illness, right? So sometimes you get a headache. That what is the cause of the headache? So there could be different causes. So it's not attributed to menopause. But and another thing is a lot of times, you often hear, oh, female, they're not interested, or, but have you ever, speaking up to the males, have you ever stopped to think, what exactly is going on? Why is she not interested, right? Can be a lot of things going on. So it's really having a conversation, having discussion, sharing thoughts, sharing feelings, sharing what each one is going through. That is how you will know that, yeah, this is something real. This may be what is happening. Um, and it should not be ignored because these symptoms are real and they can, of course, affect how an individual, you know, continue within having intimacy, whether it is on the male or the female point of view. So, understanding knowledge is important. And so, as mentioned, I am happy that you have taken the initiative to educate, individuals on various topics because education is key, knowledge is key, having the wisdom is key because without knowledge, without wisdom, the people will perish. And that is not the intent that God wants us to perish, but He wants us to exercise wisdom in all things. Again, I would like to thank you for the opportunity to share with you, which I am happy to do any topic. Blessings to you, one and all.